Hi, my name is Paige Gilliland, and my group members, Kelly, Haley, Ellie, Rachel, Allie, and I, have created a project focusing on understanding and dissecting common mental health biases and their effects on patient outcomes. The topic of this presentation is important because, according to the American Psychiatric Association and the Mental Health Foundation, nearly 90% of people with mental illnesses claim that stigma and discrimination have a negative effect on their lives, and more than half do not seek treatment due to these concerns. The main purpose of our education was to inform nursing students about some common biases that nurses hold when caring for mental health patients and how these biases affect patient outcomes. In order to find information on this topic, we use the databases PubMed, Medline, CINAHL, and PsycInfo. The key words that we searched when finding our articles were nursing students, nurses, stigma, perception, biases, education, and mental illness. To gather our data, we presented our research regarding common mental health biases to a junior mental health class. We utilized a pre-presentation survey to assess the students' current knowledge on mental health biases before providing education. We then gave a 10-minute PowerPoint presentation to educate the students on our topic. During the presentation, we discussed and dissected common mental health biases. We then described how these common biases affect mental health patient outcomes and interventions to reduce these biases. After our presentation, a post-survey was used to reassess the students' knowledge and their opinion of the education they received.
Before providing education regarding mental health biases, we assess the students' knowledge of these biases. Some of the results from our survey include 90% of the students claimed to either know or have someone with mental illness, 35% strongly agreed or agreed that mental health patients are more likely to be violent, 97.5% strongly agreed or agreed that psychiatric illness impacts physical illness, and 100% strongly agreed or agreed that personal biases can affect patient care outcomes. After our 10-minute presentation, we utilized a post-education survey to see how our education affected the students' knowledge on mental health biases. 20% of the students agreed that mental health patients are more likely to be violent. This was a significant 15% reduction from the pre-survey responses prior to debunking this myth. 95% agreed physical illness impacts psychiatric illness. 100% agreed personal biases can affect patient care. 97% agreed that education helped them understand common mental health biases. 97% agreed this education was useful in debunking mental health biases. And 97% agreed this education helped them understand how biases can affect patient outcomes.
Some recommendations to reduce these biases include arranging students into proper clinical placements, providing early education, and creating more awareness. For in-person clinical, contact was generally deemed more effective than video representations. Exhaustive literature indicate that there was significant improvement in nursing students' attitudes towards mental health after completion of their mental health clinical. Prolonged clinical placement would also be beneficial because studies have shown that the length of mental health nursing practice significantly accounted for mental health nurses' attitudes. Nursing students' clinical rotations are typically in more acute situations where they see patients in psychiatric crises, which means they may miss the whole recovery process and not see these individuals living full functional lives with a mental illness. Early educational intervention is key because there's a greater stigma due to lack of knowledge of these illnesses in society. One study determined that the higher the education level of the nurse could potentially alleviate negative attitudes associated with mental illness. Creating awareness of biases is also essential to delivering therapeutically effective nursing care. It's important that psychiatric nursing curricula at nursing schools include topics and programs that will create awareness in students regarding stigmatization towards mental illness and its effects on patient outcomes. Based on our results, we concluded that education regarding common mental health biases effectively increased nursing students' understanding of these biases and how they affect mental health patient outcomes. And then our references.
Thanks for listening.